All right, it's time for your health check. As COVID cases continue to rise, I've gotten a lot of your questions about Paxlovid. Who should get it, where, and why are some people, like President Biden, experiencing rebound infections after taking it? For answers, I spoke with Chief of Infectious Diseases at South Shore Health, Dr. Todd Ellerin. First off, Dr. Ellerin, what is Paxlovid?
So Paxlovid is an antiviral that has activity against SARS-CoV-2, which is the virus that causes COVID-19. It basically shuts off its ability to replicate and infect other cells.
So who can get it, and how do you get it, or where would you get it?
There's an emergency use authorization by the FDA, and it's recommended by the CDC for anyone 12 years of age and older. So some kids, but all adults, you have to test positive for COVID, you have to have some symptoms, and you have to have some high-risk conditions.
When should you take this?
First of all, if you are at higher risk and you have COVID and are symptomatic, you want to take it within the first 3 days ideally, but up to 5 days since the onset of symptoms or positive test, whichever came first.
Let's talk about rebound cases, because we've heard about this a lot with the president testing positive after taking Paxlovid over the weekend. So how does this happen, and also why does it happen?
The Paxlovid rebound is you take the medication, you feel much better, you test yourself and you're negative, and then within a week after stopping the medication, you have symptoms again. So you have to have that rebound where you went from really no symptoms to symptoms again, and you test positive. The good news about it is that rebound tends to be mild, and the majority of patients still don't have it. The bad news is when you have the rebound, you're potentially contagious again. So you have to do that isolation and masking for at least 5 days, and it sort of resets the clock.
Okay, so some people have reported a nasty metal taste in their mouth after taking Paxlovid. Dr. Ellerin said ice cream or flavored drinks will help with that. Also, if you take any other medications, you want to talk to your doctor to make sure Paxlovid is safe for you and won't negatively interact with other medications that you take. You can watch my entire conversation with Dr. Ellerin at WFAA.com.
But really, you're not going to be getting this medication necessarily from your doctor unless you meet a few specific categories.
Definitely. Everything he mentioned. I mean, if you are young, otherwise healthy, you can kind of go through this on your own. You don't need to take that.
All right. Thank you, Sonia.